Common question that we get is regarding numbness or neuropathy of the feet. So question reads, I'm a 60-year-old. I've started getting terrifying numbness and tingling that creeps from my toes up towards my ankles, but I'm not diabetic and no one can tell me why it's happening. What conditions besides diabetes can cause peripheral neuropathy in the feet? And how does a podiatrist figure out which one I have? Roughly 2/3 of all peripheral neuropathy cases are caused by something other than diabetes. That statistic usually surprises most patients because the medical community discusses neuropathy almost exclusively in the context of diabetes. Your concern deserves a broader investigation. So, peripheral neuropathy describes damage to the sensory nerves in the extremities. The stocking, so-called distribution pattern, indicates a length-dependent polyneuropathy. The longest nerves in your body fail first. Causes beyond diabetes could include vitamin deficiency such as B12, which is more commonly seen in adults over 60. We have issues with folks that take metformin, or sometimes the PPIs, the proton pump inhibitors, which are used for GERD or ulcer or gastric reflux disease. Alcohol-related nerve damage can happen. Autoimmune conditions such as Sjogren syndrome or something called CIDP, chronic inflammatory demyelinating polyneuropathy. Unfortunately, chemotherapy, patients can get what we call chemotherapy-induced peripheral neuropathy after cancer survivors long after treatment ends. There are also hereditary conditions. We at Essex Union Podiatry assess neuropathy severity using several different instruments. One of them is what we call a Weinstein monofilament device that tests the ability to sense pressure in the foot. When needed, can refer folks to get a proper nerve study done or nerve conduction study, sometimes matched with muscle testing. Loss of protenic sensation in your feet means that you cannot feel injuries to your foot, such as a cut or stepping on an object, or even a pressure sore from an ill-fitting shoe. Our team coordinates with neurologists for a definitive radiologic diagnosis while simultaneously implementing protective foot care. Our offices in Springfield, Rahway, Caldwell, and in Jersey City do regular podiatric monitoring and catch skin breakdown, nail changes, and structural shifts before they escalate into emergencies requiring hospitalization. Unexplained neuropathy deserves thorough investigation, not dismissal. Come in so we can evaluate your current sensory status, establish a documented baseline, and build a monitoring plan that protects your feet while the underlying cause is identified.